Hello, everyone. This is Dr. J here, and I have a very special guest, Dr. Amanda, here with us today, who is going to be talking about plant-based medicine. But before we start, let me just say that this information is for educational purposes only. So if you have any questions about your health, please consult your primary care physician. All right, so let's start and bring Dr. Amanda to the stage. Woo! All right, so Dr. Amanda, thank you so much for being with us here today. Just tell us a little bit about you and how you got started in plant-based medicine.
Yeah, so thank you for having me. I got started, well, I'll take you back to when I first started talking about my health or thinking about my health. So I was an overweight, obese teenager, and I remember having to do these physical fitness tests in school, and we had to actually step on the scale, and they measured our body fat and things like that. And on the scale, I saw the numbers 199 pop up, and I was devastated. I 14 years old, weighing 199 pounds, and I was just like, I cannot do this. So I was like, there's no way I'm ever going to let a two be the first number in my weight again or ever. And so I started exercising. I would use my own money. I would actually save my lunch money that my dad would give me and buy exercise equipment, and just start to work out to lose weight. Then at the age of 16, I became a vegetarian. And most people are thinking like, why in the world would you be a vegetarian? It wasn't any rhyme or reason to it. I did not know anything about healthy eating at the time. I just thinking, okay, maybe this will help me lose weight more. So I was one of those more junk food eating vegetarians. I tell people my favorite meal was like Doritos and Coke, or the Big Mac with no meat, and McDonald's with barbecue sauce, those types of vegetarians that I I would do. And then as I went through undergrad and residency, I was able to, lose the weight initially and then keep it off. But then I kind of plateaued, and I was just trying to make it through school and like, okay, this is what I'm going to do. And then after I finished residency, I actually went to a nutrition conference. And I just went to that because it was at a spa and we were going to have a great time. And it was actually in Arizona. And I was like, oh, I always wanted to go to Arizona. So I'm going to go to this nutrition conference. And I remember going there, and I believe they were talking about plant-based nutrition. And the speaker said, you cannot out exercise a bad diet. And I was like, okay, that hit home for me. Like, if I didn't remember anything else about the conference from that time, it was just that actual saying. So then I was like, okay, so what is a healthy diet? And knowing that exercise is great and everything, we always need to exercise, but just wondering, okay, what can I do to make myself healthier? And then also give that to my patients, because in my family, it was a lot of heart disease, diabetes, cancer. And you just see that as you're growing up, and like everyone as they got older, that's what they died from. And it's like, okay, what can I do to change this? So I actually started implementing more plant-based nutrition into my diet, and actually been able to lose weight, keep it off, and keep myself healthy, good blood pressure, good cholesterol. And I'm just now trying to spread the word for others so they can actually learn how to do this also, and live that healthy life. So when I'm 90 years old, I'm still like, hiking, traveling, and not being a burden to my family because I'm sick all the time. So
Man, I love that story. Thank you so much for sharing. And I gotta say that you're gonna live until 100. Let's give you an extra 10 years, okay?
I'll take it. I'll take it.
All right. So, what would you say are the benefits of a plant-based diet? And what would you tell someone who is considering from transitioning from a carnivore diet to a plant-based diet?
Yes. So for me, as you heard in my story, my motivation initially to plant-based nutrition was weight loss. So definitely, if you do a whole food plant-based diet, you're going to lose weight and be able to maintain a healthy weight. So that's very heavily researched. People have seen that. Then my motivation to continue on a plant-based diet is that it actually can decrease your risk for certain type of cancers, breast cancer and prostate cancer, colorectal cancer. It also can lower your blood pressure and get you into a normal range and prevent you from having to take medications or even get you off of medications, but you definitely have to work with your doctor. It can also prevent and reverse diabetes. And so most people think that you can't reverse diabetes, but there's some, studies out there that you can actually do that. And then also help with heart disease and prevent the buildup of plaque in your arteries. So that actually can stop the progression of heart disease and prevent you from having a stroke or a heart attack. There's also some studies that a lot of people don't realize that it can actually help with Alzheimer's disease and actually possibly reverse. So we know that there's no medications out there that prevents it or stops the progression, but there's some studies that's out there that possibly a plant-based diet can help with that. So there's so many different things that a plant-based diet actually helps with. And so just hearing all those things is like, why wouldn't you want to try it? But I know our meat eaters because I was one of those meat eaters. And actually, a funny story is that my father used to work for a meat delivery company, right? Growing up. So this is where we got all of our things, our meals. And so hot dogs, bacon, bologna, sausage, all those different types of meats that we would have. And if you came to one of our birthday parties growing up, we would have hot dogs, so stuff like that. So I can understand that people, there's certain meats that they grew up with, and some people just like the taste of them. And now, as far as transitioning to a plant-based diet, which I didn't have growing up, is they have these plant-based alternatives for meat. And I usually tell people you can try those. My diehard meat eaters, they're like, okay, it tastes okay, but it's not exactly like meat, but it's healthier. It tastes close enough. You can try it and see. And you don't have to necessarily go all in all at once, especially if you're just trying to prevent disease and not necessarily reverse it. So if you're just trying to prevent disease, then you can actually slowly transition to a plant-based diet. So going from eating hamburgers, you now have the Beyond Burger, something like that, or a black bean burger that you can eat. And if you like, I don't want to do those alternative meats, then I tell people to just actually add in fruits and vegetables to every meal, because not only is it important for you to stop or limit those animal-based or meat-based products, you actually need to add in those fruits and vegetables that have a lot of different nutrients that your body needs to actually heal, repair itself, and prevent disease.
Awesome. Whoa. All right. You see all the benefits here of a plant-based diet. So definitely consider all the options that Dr. Amanda has provided. That is great. Now, what are some ideas of plant-based foods that someone can, that someone can eat around exercise?
Yes. So we want to exercise. We want to actually decide when we're going to exercise. So if you are a person that exercises in the morning, then you probably wouldn't have your breakfast necessarily before going and exercising. So you would have like a small snack. So I would say like a piece of fruit and almonds, something like that, to where you would just get your body started. And then your post meal, like after working out, then you want to have your full breakfast. So like whether you're eating oatmeal with almond milk, chia seeds, and some berries, just something to replenish your body. And if you're a person that's going to be doing like a longer workout, then you probably want to actually eat a little bit more before you actually work out, because you need that endurance. So you may do like a smoothie where it has more some more protein and some more carbohydrates in there for you. So adding in maybe like a nut butter to your smoothie, along with kale and other fruits, because you need the carbohydrates to get you going, and then some of the protein to keep you going, You don't want to do it too close, like I said, to actually exercising, because that's just going to sit on your stomach and things are just going to come out. So you actually want to digest it before you actually go and exercise. And then you want to also make sure you eat within 1 hour of finishing up your exercise, so your body has those nutrients to rebuild and repair your muscles and things like that that were actually used during exercise. And we always forget, but I want to point this out: water. We want to make sure we're drinking enough water. We talk about a lot of food, but you definitely have to make sure you're hydrated, because our body is made up mostly of water. And if we don't replenish that, then we're going to have all sorts of other issues and injuries and things like that.
Woo, yes, I love all of that, especially anything with exercise and then diet. Oh, yes, that was amazing. Thank you so much for that awesome answer.
Yeah.
All right, so last question. Now, what are some ideas of plant-based foods that someone can consider if they have chronic disease?
So, chronic disease, if we want to try to actually decrease the amount of medication that we may have to take, which, like I said, again, you want to talk with your doctor about this, is to actually eat whole foods. So we don't want to do a lot of the processed foods. So actually, a diabetic should be eating a high carbohydrate, high fiber diet. And most people are like, wait a minute, that's not what I usually heard. But if you actually think about it, fruits and vegetables are usually high in carbohydrates and high in fiber. And that actually has been shown to prevent and even reverse diabetes. So people can actually get rid of some of their medications and things like that. And their blood sugars are better controlled. They decrease their complication risk from diabetes, like you get with a blindness, kidney failure, and actually increase your risk for heart disease. So if you actually do these things, you actually can prevent those complications. For someone with high blood pressure, our leafy green vegetables, those dark green vegetables like our kale and spinach, collard greens, actually have nitrates in there. And if you, some people know about some medications that there's some category of medications that's actually nitrates, and actually helps with blood pressure. So this is a natural way that you can actually help decrease your blood pressure by eating more of those greens. Now, you don't want to smother it with the ham hock and salt, but if you eat those other things, then that actually will help you decrease your blood pressure.
Awesome. Well, thank you so much. Those are some great tips for people with chronic disease to figure out what are some plant-based foods that they can consider. Now, Dr. Amanda, where can we find you if we want to stay plugged in? Come on, you gave all this information. We need to know how to find you, Dr. Amanda.
Yes, so I'm on Facebook and Instagram at Dr. Amanda Adkins, and my last name is spelled Adkins. And then I also have a website at dramandamd.com, and you guys can check me out there. I actually have a free resource also. You can actually check out I call them 7 yummy plant-based recipes to try. So I always like for people to try that because sometimes people are confused about where to start. They don't know what to actually eat, things like that. So those are just some recipes you can try. And just try to eat more fruits and vegetables. If you do nothing else from listening to this interview, just add in more fruits and vegetables and you'll be healthier.
Nice. Well, thank you so much for coming on and blessing us with your knowledge. We appreciate you so much. All right. Well, that is the end of our episode. Bye and have a great day, and make sure you eat your fruits and veggies. Bye.